Welcome to Easy Light English. In our series Health and Wellness, we are trying to understand the cause of IBS. So in this video, we will be looking at IBS and how to manage IBS. I am saying manage because there is absolutely no permanent cure. In the absence of permanent cure, all we can do is manage IBS as best as possible. So here we are with understanding the cause of IBS. And many people suffer from IBS. So it's important to know the cause of IBS and the prominent cause being gut-brain axis disorder. And it is absolutely necessary to understand gut-brain axis disorder, which is through autonomic nervous system and spinal pathways entering the ENS or enteric nervous system, but we will be coming to that later. Autonomic nervous system and spinal pathways, it goes to the enteric nervous system, that is the nerves supplying the intestine. And this pathway, the way in which the signals are communicated, disorder, problems in gut-brain axis leads to IBS, that is one of the causes. Now, random diet restrictions and random diet recommendations both are unscientific and meaningless. People who tell you to eat something and people who tell you not to eat something, both are absolutely unscientific. If anyone says for IBS you have this, that is also unscientific. And if someone says do not eat this, that is also unscientific. In fact, even the internet is full of fraud actually. I wouldn't say fraud, misguidance. Misinformation, wrong information, full of wrong information on the internet. Someone will say don't eat pineapple, someone will say don't eat nuts, someone will say don't eat cashew, someone will say don't eat. All these are meaningless. There is absolutely no diet restriction and there is absolutely no diet recommendation. No positive or negative impact of any diet. So people who say, I eat this, they are also unscientific. And people who say, do not eat this, they are also unscientific. So let us come to the core cause of IBS and how to manage. Now this is a digestive system. From the oral cavity, tongue, pharynx, it goes to stomach and then intestine. The problem usually lies in the intestine and the lower part, rectum. So intestine and rectum, the lower part, what is the problem? We shall be examining this. Now, common gastrointestinal disorder symptom. Some of the common symptom: abdominal pain, nausea and vomiting, and bowel movement. It could be diarrhea, it could be constipation, it could be blood, it could be mucus in your stool. So abdominal pain, bloating, bowel movement alteration like mucus in stool, or it could be constipation or diarrhea, and nausea and or vomiting. These are the common GI disorder symptoms. At the outset, it is essential to understand that IBS and IBD are related but absolutely two distinct and separate problems. IBS standing for Irritable Bowel Syndrome and IBD Inflammatory Bowel Disease. Inflammatory bowel disease. So IBS and IBD are quite different. Remember, this is a syndrome, only symptoms. And this is a disease, an organic disease. So there are two distinct disorders, but they have several similar and overlapping symptoms. In fact, people with IBS and may have IBD, and people with IBD may have IBS. But IBS and IBD, irritable bowel syndrome, it's only a syndrome. You can't demonstrate any specific lesion. And IBD, inflammatory bowel disease, where you can demonstrate chronic inflammation. These are two distinct problems, but they have a lot of symptoms in common. Now, gut-brain interactions in the CNS and ENS. As I told you, CNS, central nervous system, the brain. ANS, the autonomic nervous system, the spinal pathways. And here we have the ENS, the enteric nervous system. The enteric nervous system means the nerves supplying the GI tract. The nerves which supply the GI tract, particularly the lower part of the GI tract, that the spinal pathways and the autonomic nervous system, this is called the gut-brain axis. Gut-brain axis. Gut refers to the GI tract or food tube, and through the spinal cord, the nerves communicate with the autonomic nervous system and the central nervous system. This relationship is called gut-brain axis. Now, differences between IBS and IBD. IBS, irritable bowel syndrome, and inflammatory bowel disease, IBD. IBD can occur anywhere in digestive tract, anywhere. IBS will be confined to upper or lower digestive tract, usually colon or rectum. In IBD, inflammation, ulcer, lesions, erosion of inner GI lining, this is more or less permanent. At any time you can see there would be inflammations, there would be ulcers, there would be other lesions, erosions. Here no lesions or ulcers, and if you have any inflammation, it will be transient, temporary and self-limiting. So no permanent lesions. That's why we are saying syndrome, not disease. IBD can have extra intestinal symptoms, poor vision, skin rashes. In IBS, symptoms are mostly related to food and digestion, like belching, bloating, abdominal pain, diarrhea, constipation, mucus in stool. But in IBD, you can have symptoms unrelated to intestinal or digestion, like joint pains, skin rashes. IBD, although we are not dealing with IBD, but just a brief overview, we will be mainly dealing with IBS. IBD may develop anywhere in the GI tract, important, anywhere, not only in the intestine. Inflammation with lesions, ulcerations present permanently. They are permanent and they can be diagnosed by suitable tests like endoscopy, MRI, CT scan. You can actually demonstrate where the problem lies. IBS, mainly large intestine, colon and rectum, not anywhere in the GI tract, only colon and rectum or large intestine, the lower part. Occasional inflammation, not permanent, transient, occasional, no ulceration, no lesions, no specific diagnostic test, endoscopy, MRI, CT scan, all the tests will be negative in IBS, but they will be positive in IBD. IBD, endoscopy, MRI, CT scan will reveal some changes, reveal some ulcerations or lesions, but all these diagnostic tests, they will be absolutely normal in case of IBS. So diagnosis is just by exclusion of other diseases. Now this protein, this particular type of protein is an indication of the degree of inflammation. The level of this fecal calcoprotein is an indication of how severe the inflammation is. So you will find high levels in IBD, inflammatory bowel disease, low to normal in IBS, irritable bowel syndrome. This will be low or normal, whereas in inflammatory bowel disease, high levels. And if IBD is associated with IBS, then still higher levels. So this is one test for differential diagnosis. What are the common symptoms? Although we said that IBS and IBD are two distinct problems, we have some common symptoms. And now note that all patients will not have these symptoms. These are some of the symptoms that could be present. It is not necessary that every patient will have these symptoms. So some patients may be having abdominal pain or vomiting. Some patients may be having altered bowel consistency, that is constipation or diarrhea. Some patients may be having altered bowel frequency, how many times they go to the toilet, and bowel motion urgency, you can't hold it. But in general, IBD is usually more severe because it requires lifelong medication or even sometimes surgery, whereas IBS requires counseling on gut health and some lifestyle changes and minimal medicines. Types of IBD, although we are not dealing with IBD, the types of IBD: Crohn's disease, ulcerative colitis, microscopic colitis including viral colitis. But we are not dealing with IBD. IBS. You have IBS-D where diarrhea is predominant. IBS-C where constipation is predominant. IBS-A where you have got the alternating constipation and diarrhea or asymptomatic. IBS-M where mucus passing could be the main problem. IBS-U unidentified, no typical symptoms. And IBS pain in different parts, they would be the only predominant indication in IBS pain. So it could be with diarrhea, with constipation, with alternating diarrhea and constipation, or with only mucus, unspecified IBS, unspecified, no typical symptoms, or with IBS pain being the only symptom. Now, cause of IBS. We have shown that the gut-brain axis disorder, gut-brain axis disorder, that is a hypersensitivity of the nerves in the walls of the GI tract. The nerves supplying the walls of the GI tract or the walls of the intestine, how they communicate with the brain and the autonomic nervous system. So the nerves found in the wall of the gastrointestinal tract or food tube, let us call it food tube, the food tube. So the nerves found in the walls of the food tube, that is called the ENS. That is called the ENS, enteric nervous system. Now, how does the enteric nervous system communicate with the brain, the central nervous system, using the spinal pathways and autonomic nervous system? If there is a disorder, a problem, that could be one of the main cause of IBS. So we have the gut-brain interactions via CNS, ENS. So CNS and the brain, autonomic nervous system and spinal pathways, and ENS, that is the enteric nervous system, the nerves in the lower part of the intestine. And this forms the gut-brain axis. And abnormal signals in the gut-brain axis would be the cause of IBS, one of the main causes. Second reason, altered microbial population. Altered microbial population. So normally Commensal, these are neutral. means neither friends nor enemies, neither good nor bad. Commensal, microorganisms, suddenly become pathogenic, suddenly start attacking, suddenly become your enemies. So those microorganisms which were neither friends nor enemies, due to some reason they become your enemies and they become pathogenic, means disease producing, and start infection and inflammation. And another cause could be the loss of symbiotic bacteria, particularly due to heavy antibiotic intake, causing imbalance in good bacteria versus bad bacteria. So good and bad bacteria balance is altered, or the neutral, they were neither good nor bad, suddenly became attacking, suddenly became pathogenic or disease producing. A third cause may be post-infectious following strong antibiotic administration. So what would be some of the symptoms? Again, we are emphasizing that symptoms vary from person to person. Don't think that all the symptoms would be present in one person, or symptoms present in one person would be the same as the symptoms of another person. Some of the symptoms could be mucus in stool. In fact, this is the only symptom which I have. I am myself an IBS patient. I am myself a patient of IBS, and the only symptom I have is mucus in stool. That is the only one symptom I have. Urgency in some people means they have to rush to the toilet. Feeling of incomplete evacuation. Even after you come back from toilet, you feel that you have to go again. Abdominal pain or discomfort. And other causes could be sleep disturbances, anxiety and depression, chronic pelvic pain, and other symptoms. Symptoms vary from person to person. No two persons will have the same symptoms. Never assume your friend with IBS will have the same symptom as you have. Two persons having IBS will not have the same symptoms. The symptoms will change. The symptoms will vary. For instance, of all these symptoms, I am an IBS patient. I have only one symptom, mucus in stool, occasionally. Management. Now, anxiety can be controlled through positive mental health practices. Positive mental health practices. Positive mind with positive people. You can acquire through meditation, happy, healthy lifestyle, or a proper attitude and determined self-control. Drugs like prothiazide and buspirone may help if taken under medical supervision. Do not take tablets without medical advice. Now, one of the best methods was suggested by a government hospital doctor in Gujarat to one of my friends. And a beautiful advice it was. He said, every morning when you get up from sleep, repeat with conviction to yourself, I am normal. Say, I am normal. I am normal. I do not have any disease. I am perfectly normal. I am healthy. Repeat this 20 times, 30 times. The first time when you get up in the morning, that will correct your attitude. Say, I am normal. I do not have any problem. I do not have any health problem. I am healthy and fit. I am normal. Repeat it. That's the advice given by the doctor, and really it is a wonderful advice. General health. Maintain a good general health, both physical and mental. Avoid extremes that trigger problems. Now, any problems, not necessarily digestive disorders, any problems, because any problems could worsen your IBS. Any adverse condition resulting in traumas or jolts to the system could trigger or worsen the IBS problem. So control all the problems, not only digestive disorders. Visit your clinic or hospital for advice on good gut health. good gut health, vital, good gut health. If possible, attend the specialized IBS clinic at AIMS in New Delhi or CMC at Vellore. If possible, attend the IBS clinic. Now we have confirmed from all reliable sources, no diet restrictions. Absolutely no diet restrictions and no diet recommendations. Every expert recommends a normal diet, no list of restrictions and no list of recommendations. Any arbitrary restrictions made by some people, including ignorant doctors. Actually, very few doctors really know about IBS and how to manage that. They may be doctors, they may be having degrees, but very few doctors, particularly in West Bengal, very few doctors know about IBS. So, doctors, even doctors, those who arbitrarily recommend some diet or restrict some diet, either they say eat this one or they say do not eat this one. Both recommendation and restriction are baseless and unscientific. There's absolutely no restrictions in diet. So any restrictions given to you by doctor, even if he is doctor, it is absolutely nonsense. There is no diet recommendation, no diet restriction. No list of restrictions and no list of recommendation. So have normal diet. There is absolutely no diet restriction, no recommendation. So if anyone says do not eat this, that's absolutely an unscientific nonsense. If anything doesn't suit an individual, avoid it, but no general diet advice or blanket ban should be imposed. So IBS does not require any diet restrictions or any diet recommendations. Now, we are sharing my personal history. Now, remember that IBS patients, each one is separate. Each IBS patient is separate. So how I manage it may not be valid for someone else. Don't think that this method will work for everyone. This method works for me, but it may not work for someone else. So I'm just sharing my personal, how I manage my IBS, but that doesn't mean that it will suit everyone. Now I have IBS with just two symptoms, mucus in stool and total fatigue or exhaustion after defecation. After I come back from toilet, if I have mucus in stool, then I'm absolutely exhausted, zero energy. I don't have abdominal pain, I don't have constipation, I don't have diarrhea. I have only mucus in stool and extreme prostration and fatigue. So occasionally it flares up, but usually it's under control. So the advice I got from the head of the Department of Medicine, he is now retired, of a railway hospital, he gave me this advice: 1 glass of milk in the morning, and thereafter nothing except water for 1.5 to 2 hours. So in the morning I have 1 glass of milk and then 2 hours gap, 1.5 to 2 hours gap. And then you can follow your normal diet. For me, it has worked wonders. And as I told you, what is working for me may not be working for you. So have your own management system. But for me it works. 1 glass of milk in the morning, 1.5, that is 1.5 to 2 hours gap, and then normal diet. Absolutely. Very rarely now I get worsening of my IBS. Usually it is well under control. So I wish you very good health, and remember that public awareness videos are not a substitute for expert medical advice. So you must visit a clinic or a hospital for proper guidance, and if possible visit AIMS in New Delhi or Christian Medical College and Hospital in Vellore. If possible, visit the IBS clinic at AIMS in Delhi or CMC in Vellore. So thank you and goodbye.